So normally in Instagram live I speak about the remedies. I would be happy that if you ask me questions, so that once we start Mathematica, then it is difficult for me to get into the question sessions. So if you have questions, do ask in the starting only. I have got one question on WhatsApp, but if there are no questions, then I will take the question of the WhatsApp. Yeah. So good afternoon, and today I'll deal with a very interesting, a very important, and a very the biggest polychrist of a Mathematica. Normally, sometimes it becomes difficult to understand when to prescribe this remedy. I am talking about sulfur. Sometimes it be, yes, I'm fine, Dr. Navjot, good afternoon. Sometimes it becomes difficult to understand where and how you prescribe sulfur. Different authors, different doctors have different approach on seeing how sulfur is to be prescribed, because sulfur has most of the symptoms in a Mathematica, 3000, 4000, 5000 symptoms. If you see Allen's encyclopedia, if you see Herring symptoms or the basic source books, it has all the symptoms present in us. For example, if we were studying sulfur in the first year from Kent's Mathematica, we thought that we are sulfur only, because every symptom of sulfur matches our symptoms. This becomes difficult, hence it is important to understand, of course, what I feel about sulfur first, and then in general what you think about sulfur. So welcome Dr. Barbel, good afternoon to Vishaka. Now sulfur, as it is said, that it is a ragged philosopher. Very easy to mug up the symptom, very easy to understand the symptom, but how will you prescribe that symptom in a patient? How will you understand what is the meaning of ragged philosopher becomes very, very difficult to understand. So apart from understanding that symptom, let us go to some other symptoms which I feel are very important to see in a sulfur patient. For example, a sulfur patient has a now we have to differentiate sulfur soric symptom, sulfur psychotic symptom, and sulfur syphilitic symptom. Now, sulfur patient, if you want to see anxiety, a soric symptom, a sulfur patient also has anxiety, lots of anxiety symptoms in a Mathematica, but one symptom of anxiety which I have seen in sulfur in most of the cases, sulfur has anxiety about future with sadness. This symptom with sadness of sulfur is very, very important, my dear friends. If you ask a sulfur patient, if he's a homeopathy doctor, he said, oh my God, I have studied homeopathy, I am a topper, I don't know what will happen in future, where I have to open my clinic, which area I have to open my clinic, what will happen if my clinic does not work well, how will I run the family, and this, he becomes very sad thinking about that. Is that thought affecting the patient's personality? Then you have to think about this symptom to prescribe, because this symptom can be a normal symptom of any doctor. He feels that anxiety, what will happen, but if that goes to an extreme state and the patient is sad because of anxiety about the future with sadness, then you must think about sulfur. Are you with me? And what happens? How will you take this symptom? The symptom of anxiety about the future is so pronounced, it is so profound in sulfur patient, so much so that the patient starts having palpitation, which prevents sleep. Please write down that symptom. This is a very, very important symptom of sulfur. The anxiety is so much that it is with palpitation and it prevents sleep. The patient comes and tells you, sir, मेरे को इतनी घबराहट होती है, I have so much palpitation, I can hear my palpitation, it's audible XYZ, that prevents sleep. I cannot sleep because of the palpitation, and you must think about sulfur. I hope you understand this, everyone. Do write down something so that I'll be able to tell you how to prescribe sulfur. Otherwise, there are so many symptoms of sulfur, you don't prescribe sulfur, or you prescribe so much so, as Dr. Kent's right, the sulfur is prescribed by the physicians who are very learned, and sulfur is prescribed by the physicians who are very ignorant also. Both are sulfur states. Okay, so do write down on the comment box your understanding of sulfur, in your practice. That is very important to discuss. Second, whenever a sulfur patient is the sulfur patient, no, see, sulfur patient does have also anxiety of conscience. If sulfur patient does something wrong, he does not want to do something wrong. Otherwise, what he feels in dreams, he feels that the fire is coming from the heaven because he has done something wrong. This is a very, very beautiful dream of sulfur, that dreams of fire coming down from heaven. Fire is a sin which he is bestowed upon because he has done something wrong. So in this is a very important part of sulfur patient. He does not want to do anything wrong, because if he does, he has this type of dream. Are you with me? Are you understanding the sulfur state, my dear friends? This is what I have seen in my practice, Dr. Barbal. This I have seen in my practice. That's why I am telling you, please write down these symptoms in your Mathematica. In most of the sulfur patients, you will get this symptom. Now, third symptom is about excitement. Again, sulfur has a lot of excitement symptom, but the symptom which I have seen is excitement when unemployed. Now, the meaning of unemployed, literal meaning, okay, he does not have a job and he gets very excited. Okay, it's okay, that's also right. But something more than that, if you think about unemployment, what is the meaning of unemployment? Means there is no work. No work means what? It could be related to a job, it could be related to what he is doing in his profession, it could be related to a target set to him and he cannot do anything because of that. He feels that he is unemployed. I had a beautiful case, of depression, where the person had given the exam and she was not getting admission in college, first round, second round, third round, and the girl came to me and said, sir, I feel that I am unemployed in spite of studying so much. She was waiting for the first round, the second round, the third round, the mop-up round, and during this process she became so depressed. The first symptom she came to me because of depression was, the first line she uttered was, sir, I feel that I'm unemployed worker. I have no work. For the past 3 to 4 months, just applying. Sulfur beautifully restored I gave a simple remedy, sulfur 200 single dose in water, and the patient came out of that depressive state. So understand the meaning of unemployed also. Yes, Dr. Navjot, she's also right. Retired. When a person retires from a job, he or she feels, okay, I am not unemployed, I have no work, though everybody takes care of me, but I am unemployed. And then the patient starts becoming fanatic, starts becoming philosophical. What is this life? I should have done this, I should have done that, I should have applied for some other job, I should have started my small business, but now I am unemployed. So this is a very beautiful symptom of sulfur. Yes, Dr. Barbal, whenever you are reading sulfur, whenever you are hearing about sulfur, everybody feels that she or he is sulfur only. Such a remedy is sulfur. You study sulfur and you feel every symptom of sulfur is related to you. But I am telling you those symptoms which I have seen so many times in practice. And sometimes, I try to find this symptom, whether this symptom is present in sulfur, and then I am very sure that the remedy is right. Okay, so let us go forward. Sulfur with other remedies, the remedy has to have some fear. Now, the fear of sulfur is also very, very peculiar. Fearing of sulfur is very, very peculiar. A sulfur patient, there's one symptom in sulfur, aversion to education. Now, you are in a, you are, for example, if a doctor's son, if a lawyer's son, if any chartered accountant's son, a professional son, everybody feels, oh my god, he's a son of a doctor, a lawyer, he's so brilliant, he's in the college, and actually he is not so brilliant. I would not like to tell the name. There are some cricketers who are very, who are in India, they are very good in the area, but their sons are not able to adjust. And when you say, oh, come here, and the sulfur has that particular fear called by name being. There's a very beautiful rubric, fear called by name in the sense that everybody thinks that he is good, everybody thinks he is best because he's the son of one of XYZ, but he feels that he has done nothing in life, and he always has fear. If somebody calls me and asks me something, what will I answer? So fear called by name. Have you ever come across this type of symptom? Anyone? Have you come across this type of symptom where you feel a fear? Oh God, somebody calls me and if I'm not able to answer because he feels that I'm a son of XYZ, he feels I'm good, he feels I'm that, but I am not. That is a very, very important symptom of sulfur again. So, welcome Dr. Madan after a long time. Good afternoon. This is again a fear, a symptom of sulfur. Of course, you can go and read sulfur fear, a lot of it. This is what I have seen. Now, the symptom of restlessness. Whenever you get the symptom restlessness, the first remedy that comes to our mind is what? Anyone? The first symptom, the first remedy that comes to our mind, if you are telling restlessness, which is that remedy? Anyone? The first remedy that comes to our mind is arsenic album. Restlessness, restlessness, restlessness. But the patient is hurried with restlessness. The patient is hurried with restlessness. You must think about sulfur, the first remedy. You can ask the patient that what are you doing? He said, I'm doing this, XYZ. But the patient is actually doing nothing. Hurried in his movements, involuntary when taking anything. Whatever the patient does, he is restless. Whatever the patient does, he is restless. This is the restlessness of sulfur. Hurry with restlessness. You ask the patient, please give me that pastry. The patient will go fast. Take the pastry, come fast. Not needed. But the patient, there is so much internal restlessness in that patient that he cannot do anything very calmly. That is a very important syphilitic symptom of sulfur restlessness. Are you with me? Are you with me? Are you understanding the sulfur personality as a whole? I am going step by step, the soric, the psychotic and the syphilitic part of sulfur, which you should see in that sulfur patient. Ragged philosopher, mania philosophical, imbecility, rag seems beautiful is there in sulfur. Very, very important but difficult to understand and appreciate in a person. But this hurried symptom of sulfur is such an important symptom. You will see normally whenever the word hurried comes, the first remedy that comes to our mind is sulfuric acid. Sulfuric acid is there, but sulfur is the boss of everything. Are you with me? Are you understanding? And now comes the sadness. Yes, the patient can say that cure me fast. So cure me fast could be carrot desires to be fast also. That rubric would also come in this symptom, Dr. Navjot. Now the sadness part of sulfur. The sadness part of the sulfur is so important. You will never give sulfur if I tell you this symptom. The patient, you take that symptom of the patient says that, my God, the assistant says, sir, the patient is so sad, always dwelling over his condition. I am like this, I am like this, I have a problem of career, I have a problem of money, I have a problem of children, And the patient goes on and on and on and on, dwells constantly on her condition. And you can never take this symptom, because whenever the symptom comes constantly dwelling, we have the first remedy natramur and so on and so forth. We never think about sulfur. But when the patient is sad about her mental condition, the patient is sad about her condition, and she keeps on and keeps on and keeps on telling what happened to her, why she this, how is she this, and why she's lazy, why she's diseased, why what happened to her, constantly dwelling, and the patient is sad. You must think about sulfur, my dear friends. Are you with me? Don't always think of, dwells on past disagreeable occurrence, and then natramur, and then calcarea carb, and then zincum metallicum, and then lycopodium, and then phosphorus. Or you can think about these remedies are there, but sulfur is the boss. I always tell this symptom, sulfur is the boss, because sulfur is a very, very important remedy, so much sensitive that he is sensitive to the filthy odor. We say sulfur is, does not like to be washed, but whenever the sulfur patient is coming in the room, now see, it is summers in Nagpur, and the temperature is 45 degrees. And if the previous patient had worn the socks which is smelling, and next patient is sulfur, he says, Doctor Sahab, there is a typical smell from your clinic. I think somebody must have worn the socks and not taken out. This is the sensitiveness of sulfur, my dear friends. The sulfur is sensitive to filthy odor. Have you ever seen this symptom? Have you ever appreciated this symptom of sulfur, my dear friend? Sulfur patient is very sensitive to odor. I had a beautiful case of asthma of a child of 12 years of age. He had taken lot of treatment, homeopathy, allopathy, Ayurvedic, but no pathy was able to, there was no relief to the patient. We had taken the case, we also prescribed the remedy, but we did not prescribe the patient sulfur. The patient was not totally better. But there was a strike, there was a jam around my clinic, and so the mother and the child had to walk a few distance because of the. And then the mother told, my God, sir, coming to your clinic was so hassle, not because of the rush, but my child, cannot bear the odor. He can find bad odor from anywhere. We cannot smell it, but he can smell the bad odor. And then he gets, vomiting feeling. He does not want to go. He feels irritable. He wants to drink. He wants to apply balm in the nose so that odor goes. And this was such a fantastic symptom. By chance, we caught this symptom, sensitive to filthy odor. I prescribed on that day sulfur 30, and after a week sulfur 200. Till date, the child comes to me. It has been 6 months now. No attack of asthma. So this is the importance of, first of all, understanding the remedy, and then catching the symptom of that remedy so that you don't make a mistake. Sometimes, one symptom, a right symptom, and you can get the whole drug picture of the patient. Are you with me, everyone? Jugal Kishore, yeah. Are you with me? This is the importance of knowing the remedy in a nutshell without reading the remedy every time. I don't try to read sulfur every time, because every time you read, every time get new symptom and you get confused. So whatever experience I have got in 30 years of treating a sulfur patient, that I see first in the patient. If it is not there, then I can go forward. Okay. So let us see one question. Sir, your experience about carcinosin, can you use a person who have suppressed sarcoma? Carcinosin, if you have attended my lecture on cancer, I have dealt with carcinosin in detail. You must remember one word for carcinosin, and that is catharsis. Go and open the dictionary, first understand the meaning of catharsis. I think you'll be able to appreciate and understand carcinosin better. If you don't, then I'll go forward. My vision has suddenly changed. There's a blurred vertical strip in the center of my field of vision. At first, the letters seem to fall down as if into a hollow. 14 days ago, last Monday, following laser treatment, they now see to rise upward within below. When looking at a face, there is a blurred vertical strip in the center of my field of vision. So this is, I hope Dr. Babel, you don't have this problem. This is a symptom of a patient. So this is a very, very typical symptom. If I don't know whether I have had a less opportunity treating this type of cases, but this is a very, two things are important in this case. First of all, because of laser, this is problem has occurred. So basically, okay, there's a patient, that's okay. So because of laser, this thing has happened. That means a strong light in the eyes, and that has caused a problem. I had a similar case when the patient, now only about 15 days back, the patient had done laser treatment because when I was opening a bottle, that cap of the bottle struck the eyes and the retina, and there was a problem. So laser was done, but laser failed, and the patient had letters upside down and all. So I just prescribed the patient which remedy can you think about? I prescribe a patient Belisper. Belisper LM potency I did not have, so I prescribed Belisper 30 twice a day for 5 days and called the patient. And to my utter surprise, Belisper treated that. The patient came to me and said, I am 50% better. The only symptom I took for prescription was injury to deep tissue because of laser light or because of the cap. The result of the injury I took for prescription. So Belisper treated that case. In this case, Dr. Barbal, we find the laser light has basically caused a problem. 3 remedies that are very, very important which I have used in my practice is, first is Belisper, because I have had wonderful result with Belisper. Second remedy, again very, very important, laser beam type or radiation type. You can think about X-ray. I have not got good results with radium brome, but I have got good results with X-ray. Third remedy you must think about in this case, now it is a strong light which is causing a problem in the tissue. There's a breakage of tissue, there's a breakage of the white matter or the retina because of strong light, laser beam. So in this case you can think about one remedy which is very, very important. I have used in my practice and I have got good results. Think about calcarea fluor and calcarea carb. Symptomatically, if you see this case where you find that the letters are dancing, the letters appears vertical, you will be again surprised. The remedy is lysine. So think about these 4 remedies. Symptomatically lysine, or you can think about Belisper, X-ray, calcarea fluor and calcarea carb. Depending on which side, left side, right side, depending on the first symptom the patient had when he came out of the laser treatment, and the mental thought which the patient had when the patient went to the treatment. These 3-4 things are very, very important in prescribing the remedy. I think it is of all stress that vision changes. No, it could be the reverse part, Dr. Barber. Because of the vision change, the patient goes in stress. So there is a cause. So we first think, because this is a syphilitic part, ultimately the laser has affected the eye, the soft tissue. So the first remedy, do think about Belisper, and you can also add one remedy because I had a case where the patient had the same problem, and he came to my OPD, and he came in OPD and he came like this. So I said, what is happening, sir? I cannot face light, and I put cold water from the bottle and I put in the eyes, and I feel much better. So when the cold water is there, I open the eyes, I can see properly. In that case, Dr. Barbal, only with the modality I prescribed Ledampal. Now Ledampal has a symptom that the pain in the bones and joints are better by cold. The same philosophy applied in the eyes, and the patient was better. So sometimes these type of cases you have to think out of the box depending on the symptom similarity. I hope this explanation is okay, Dr. Babal. Right side. Yeah, this explanation, there has to be the vital force will tell you something, and surprisingly lysine is also a right-sided remedy. Belladonna is also a right-sided remedy. You can if the patient because of laser and a visual problem has twisting of the eyes, then you can think about Agaricus muscaris also, which is also a right-sided remedy. Yes, so you can ask some symptom and then we can get back to the case. My cancer of prostate 3 months ago, operated for kidney stone, left side, pain and burning on urination, warm foods and warm drink desires. A patient 50 years, cancer of prostate 3 months ago, operated, okay, for kidney stone, left side. So now the patient is suffering from cancer prostate and he is already operated for left side kidney stone, and there is burning urination and warm food and warm drink desires. Actually, I would not be able to prescribe only of this symptom because we are treating a case of cancer. So if I get some syphilitic symptom more, I would be able to prescribe better. In this scenario, whatever you have told me about this type of complaints, 2 or 3 remedies that comes to my mind, I will just share my knowledge with you. First, think about phosphorus, think about sepia, because in your case you have written that the patient desires warm, so assumingly the patient has to be chilly. So phosphorus is there, sepia is there, graphitis is there, creosote you can think about. You can think of argentum metallicum and camphor also. Okay, yeah. So, but in this case, if you ask me, see, phosphorus is there, sepia is there, argentum metallicum and conium maculatum. All the 3 remedies are, 4 remedies are left-sided. I think all the 4 remedies are chilly. So you can think about this old age problem already operate in. Surprisingly, all these 4 remedies are left-sided remedies, and the patient suffered from left-sided stone. So assumingly the patient appears to be left-sided personality. So left-sided, chilly, prostate involvement, gland involvement. Think about conium, phosphorus, sepia. I think argentum metallicum also is a left-sided remedy. So I think this is okay. Some questions have been scrolled up because I was just answering the question of eyes problem. So this is how you have to understand the remedy, and this is how the mathematical works. So we were talking something about sulfur. I think we can do sulfur at length, because when you start talking of sulfur has so many symptoms. One symptom which I want you all to remember in, sir, I am suffering from bloating in evening, IBS in my old problem, aggression, hot drinks, milk, yeah, doctor. Think about lycopodium, think about China, think about Paris quadrifolia, think about sulfur also. Sir, please share your case of vitiligo and give some instruction. I have a case. Yeah, vitiligo, first of all, now one-sided disease. In vitiligo, you have to be absolutely blank and let the patient talk. Whatever symptom the patient is telling, if it is stuck with a syphilitic symptom, take that symptom. If not, go with the non-verbal communication. If not, go with the state of the patient. If not, see how the patient developed vitiligo. That's how basically I understand of case of vitiligo. I would definitely share a case of vitiligo. I would require some time for that. Okay, so I think it's already half an hour up, and thank you for joining me, and thank you for being a part of this YouTube live for years. And I hope you enjoy as much as I enjoy sharing knowledge with you. Thank you so much. Until next Thursday for my Instagram live. Thank you so much.